possibility of getting infected yourself in a taxi or on a bus, at work, at the shops, at school or university, whilst you are visiting a clinic or even visiting a hospital. These concerns are understandable and reasonable because as the country gradually opens up, as we resume more activities, the risk of infection inevitably increases. Yet even though the risk of infection is greater, it is by no means inevitable. Through our behavior as individuals, we can reduce the likelihood that we will get infected or even infect others. And it is through our personal and collective actions that we can continue to delay the rate of infection across society in our communities. Studies show that wearing a cloth mask or similar piece of clothing that covers both your nose and mouth at all times when one is in public is one of those measures that reduces the rate of transmission of the virus. Now, millions of South Africans, including small children, are now wearing cloth masks whenever they leave home. There are, however, some South Africans who have not yet taken up the practice of wearing masks. We would like to encourage everyone in our country to wear masks when they are in public. Let us make sure that we do not share masks and that we wash our masks thoroughly in soap and water after each use. The wearing of masks, however, is no substitute for regular washing of hands with soap and water or sanitizer and maintaining a distance of at least 1.5 meters from other people. Let us all remember not to touch our faces with unwashed hands and clean and sanitize surfaces that we touch regularly. We should also keep in mind that social distancing is still one of the most effective ways of reducing the spread of the virus. These basic practices are becoming even more important now as we ease the lockdown and enter a new phase in our coronavirus response. These are still the best ways of containing the spread of the virus. Our medical experts have advised that interventions which some people are embarking on, such as setting up fumigation tunnels and body spraying, should not be used as they have no proven benefit and may even be harmful. From the outset, we knew that extreme measures were needed to slow community transmission. But we also knew that a nationwide lockdown could not be sustained indefinitely or forever. With a move to alert level 3 from the 1st of June, our prevention response is now largely focused on the simple everyday things that each of us can do to protect ourselves and our communities. It is about each one of us taking personal responsibility whenever we are or whoever we are for curbing the spread of the disease. The power to defeat coronavirus is clearly in our hands. Our response is now also more focused on hotspot areas with the greatest rate of infection and sending multidisciplinary health teams to contain the outbreaks and ensure those with the infection get the necessary care. At the same time, we have massively increased screening for coronavirus symptoms throughout the country, at every workplace, school, university, shopping center, place of worship, taxi rank, or other public spaces where people gather.